The federal administration quietly cut $1.9 billion in substance abuse and mental health services administration funding. And then just as quietly, they reversed it. Not because those cuts were an accident, but because people noticed and those people got loud. So let's talk about what that funding actually does. SAMHSA isn't abstract. It's the backbone of how we understand trauma in this country. It's where the frameworks come from that shape mental health care, substance use treatment, and how we care for children who've experienced harm. This is funding for crisis lines, for suicide prevention programs, for school-based mental health and early intervention, for kids living with violence, instability, grief, and loss long before anyone calls it a pipeline. This is social workers' salaries. This is treatment access. This is rural healthcare in communities where hospitals have already closed and help is already far away if it even exists at all. This administration says it wants to end the opioid epidemic, but then it cuts funding for Narcan. It cuts funding for rural primary care for the very communities that are most impacted. Pay attention to what they do, not what they say. And yes, systems will fail us. They inevitably do, right? But this funding still matters because it supports the people that are answering the phones, that are running the support groups, that are sitting with kids, that are showing up for families in crisis, doing this care with their whole hearts. We can't rely on systems alone. We've learned that, right, from this administration. But we can rely on each other. This funding was restored because we are not as helpless as this administration thinks we are. Systems may falter, but we still show up. Keep showing up.